Welcome back. Medical experts remind us that the breast cancer journey doesn't always end once a patient is in remission. 18 News reporter Ariel Salk explains why side effects from treatment can sometimes last a lifetime. There's now a special team at Guthrie dedicated to managing symptoms.
During Breast Cancer Awareness Month, we are talking to Guthrie radiologist Dr. Geneva Ballard about screening for breast cancer. So, Dr. Ballard, when should women consider getting screening for breast cancer?
So our recommendation is for women who are at average risk for developing breast cancer, don't have any strong family history, to begin screening mammography at age 40 and to continue that annually for as long as they're in good health. Women who are at increased risk for developing breast cancer, and those are primarily women who have a strong family history, mom, sister, aunts, grandmother with breast cancer diagnoses, particularly if those family members were diagnosed at young ages. Those patients may be at increased risk for developing cancer, and we would want to start thinking about screening them earlier. So start doing a risk evaluation as young as 30 and making personalized screening recommendations for high-risk patients.
How do they know if they're high risk?
We usually try to estimate a woman's risk for developing breast cancer using a statistical model called a Tyrer-Krusek model. We can do that calculation at the time of a screening mammogram in any of the breast centers that we have in the Guthrie system. But patients can start talking to their doctors about that and do that risk assessment as well. For patients who do have a strong family history of breast cancer and their physician is worried that they may be at increased risk, we have a high-risk clinic that specializes in seeing those patients with strong family histories and does a full risk assessment for them.
So the screening for people with high risk is done a little bit differently.
Right. So for people who are high risk, so their estimated lifetime risk of breast cancer is 20% or greater using that statistical model that I referenced earlier, we would want to start screening those women younger, potentially as young as 30, depending on when their family members were first diagnosed. And we often add MRI in addition to screening mammography for those patients.
And so tell me a little bit about the technology of breast imaging. Is mammography the best way to detect breast cancer?
So it's our #1 screening tool. We have recently transitioned to 3D mammography, which gives us a much better look at the sort of different layers of breast tissue, as opposed to the traditional 2D mammograms in which all of that information is sort of superimposed on itself. 3D really lets us leaf through that breast tissue and get a better look at the layers of tissue, particularly in women who have denser breast tissue, which tend to be our younger patient population.
Oh, interesting. And
then in addition to mammography, breast MRI for those high-risk patients kind of functions in a completely different way, so it's not really dependent on breast density, and we're able to see even smaller cancers in those patients with very dense tissue.
And so if someone does have an issue, what's next?
So if patients are diagnosed with breast cancer, Guthrie has a very expansive multidisciplinary program. We have a breast surgeon, breast oncologists, radiation oncologists who all work collaboratively to come up with a patient's treatment plan.
How does one make an appointment to get a mammogram?
So we offer 3D mammography at Corning Hospital, Robert Packer Hospital, Troy, and Towanda, as well as the Ithaca Clinic sites. And we actually during October are offering mammography on Saturdays. So patients can make that a little bit more easy to fit into their busy schedules. You can make appointments by calling 1-866-GUTHRIE, and you can get set up for your mammogram appointment.
Wonderful. Thank you so much, Dr. Ballard, with all this wonderful information. Really appreciate you taking the time out of your day to come here.
Thank you.